I warned everybody, it's very graphic.
We're all right. We're not going to.
Thanks for the warning.
Yeah. You got a little bucket in case.
This facility here is the anchor to our $225 million investment in this battle for cancer.
I'm always proud that we have the most advanced and hopefully, world-class program. And the real pride comes in pairing that also with the ability to invent a new standard of care in the same center.
I would say that surgical oncologists have to have a lot of empathy and compassion for cancer patients. So in order to go into this field, you have to really want to connect with the patients, understand their plight, and be able to kind of work them through both from a physical standpoint and a psychological standpoint as they deal with their cancer. So it is a unique individual that really wants to go into that specialty and thrives in that specialty.
In the tube world, those tubes.
We consider ourselves responsible for that patient's life from start to finish. I think one unique aspect that we're proud of and that we have here is that we have both of us. So we have multiple experts. So even in the busier peritoneal surgery programs, there's often only one person focused on that. With us working together, we can really push the field forward.
And honestly, it tests every component of a surgeon's abilities, from the technical ones in the operating room to the emotional ones in the clinic and the strategic ones of, planning out a treatment course and trying to come up with new ideas.
Dr. Wagner's great. He's very blunt, which I appreciate about him. He, from my experience, is not the type to tell you something that's not reality.
He said it was going to be a very long day based on my scans and what he had seen, but he said we're unafraid, and that was just the greatest thing. He said, we will go in there, we will not stop, we will do what it takes.
When we were doing our debrief on Richard's last CRS HIPAC, he was still in the OR. He was talking about Richard and what he had done. And he said, I think I know Richard well enough to know what he would have wanted here. And it struck a chord with me because it was exactly what Richard would have wanted. And the fact that he knew to do that, even though it was going to take more time. And I think ultimately it probably led to 4 to 5 more hours of surgery, I'm guessing, also not a doctor. But the fact that he knew Richard enough to know what his wishes would be and respected that.
It was remarkable because I was so happy that he gave me a chance to fight. He said, your recovery is going to be hard. It's going to be months. It's tough. But I was like, I'm up for a fight. So he gave me that chance. I'm so happy for that.
We don't use drugs in HIPEC that have been around for less than probably 30, 40, 50 years. So ironically, it hasn't changed that much, although you hear about it more because I think there are more centers performing it. Surgeons have gained familiarity with it. It has been disseminated through the teachings of Dr. Bartlett and other high-profile surgeons that trained many people like myself to perform this type of surgery.
Every time I give a talk, in an international or national forum, I always use that example of here's where we started when I was training, and here's where we are now. We have come so far. But I might mention a patient that I cared for when I was training in surgery, and that was a patient who we thought had appendicitis. He was in his 20s. And when we looked in there, he had cancer of his appendix that had seeded into his abdominal cavity. And the surgeon at the time said, the cancer has spread, and therefore there's nothing we can do. And so we're talking a guy in his 20s who I had to round and see every day for 3 weeks as he slowly deteriorated from his disease. I was virtually the same age as that patient. And watching him go through this and just being completely without an opportunity to do anything for it was very distressing. At the time, kind of occurred to me, we should be able to do better with this disease than that. But I think that was the original motivation for me to really be in this field. one of the barriers that we have in kind of moving this field forward is the fact that it's such a rare cancer and people aren't aware of it. There aren't the large walks associated with it and organizations and the lobbyists to help us receive funding for research dedicated to this field. So it's very hard to move forward and make advances because we just don't have the money behind it to support the research associated with this.
We are the best there is at today's available options, but that's no place for us to, rest on our laurels or feel like we've reached, a peak. This is a layover, in my opinion, for what comes next.